I think there's a lot of special things about Duquesne University. I was a PhD student here, and I had such a good experience. It was academically rigorous, but the faculty really cared about you and you felt that support. And I wanted to be a dean at a school of nursing that was the culture. Pittsburgh is a great city for healthcare. We have hospitals and clinics and clinical rotations all around us. Our students are welcomed at all the clinical facilities. Also, being in Pittsburgh, there is a lot of nursing research and medical research that occurs in our city, which our students are exposed to, which is really, really important. We give a liberal arts education, so students learn to critically think and they learn about the arts. We're also very innovative. We have the first PhD online in the country, maybe the world, first PhD in nursing ethics in the country. We want to give our students the skills and the tools to manage very complex ethical dilemmas. So we do that by offering 1 or 2 ethics courses in every single program. As a Catholic institution, we're ecumenical in nature. We are inclusive of all religions and respectful of all people. But we also consider the spiritual side of patients, and we're very, very into service. So our students learn to be good citizens of the world.
My injuries have all been fractures. I did have my one and only.
We hire consultants with disability. They come to the lab and work with undergraduate students and our graduate students. No one knows their healthcare better than the person who's experiencing it.
What I do is I get out of bed.
That's one of the things that's really important for nurses to understand. You know, what are the barriers to healthcare for people with disabilities? Catherine here in the background is in a wheelchair. She uses a wheelchair. What did it take for her to get here today? How long did it take her to get dressed, get bathed?
My body, I can feel. And guess what? I sleep in.
Hi Frank, my name's Faith. I'll be your student nurse. 120/80.
It feels like achy and pulling around my incision.
Like aching and pulling around my incision.
Nurses are the healthcare discipline that spends the most time with the patients, and as such they're in a unique position to see where innovations are needed to solve patient problems. But without the discipline and the understanding of engineering, they remain problems and they remain unsolved. However, a nurse engineer, because they have both the clinical background and the understanding of the engineering perspective, they're able to put the both together and they become in a unique position to create the ideal solution that works for the patient.
During my time at Duquesne, we helped innovate a device that basically prevented backflow in urinary catheters. That way we could decrease the risk of catheter-associated urinary tract infections within the hospital.
We're a pioneer in forensic nursing where nurses collect evidence and support victims.
We were very fortunate. This law school at Duquesne was endowed with an Institute for Forensic Science and Law. Sexual assault is one of the areas of forensic nursing, but our graduates, some are coroners, some are death investigators, some work in risk management in hospitals.
I think if you feel valued somewhere and you feel heard and you feel appreciated, it's just a much better experience. And I think that is so important today, and you will get that at Duquesne.